From an early childhood, I think probably before kindergarten, I knew I wanted to be a doctor that cared for children. As a pediatric ophthalmologist, I'm pragmatic, and my whole goal is reversing childhood visual impairment and preserving vision so a child can lead a normal life. Cystinosis is a rare disease caused by an abnormal accumulation of this amino acid called cysteine. And cysteine accumulates in all the cells and all the tissues and organs of patients who have cystinosis. And the main problem is that intracellular cysteine increases so much in these cells that the cysteine crystallizes. And it's these crystals that damage critical organs like the kidneys, the brain, and the eyes. The mainstay of treatment for cystinosis is an oral drug called cysteamine. And cysteamine reduces this intracellular cysteine and significantly prolongs survival. Oral cysteamine can reduce crystals in other parts of the eye and the body because those parts have a good blood supply. And that's just not the case with the cornea. These crystals cause extremely debilitating symptoms like pain, vision loss, and horrible light sensitivity, to the point where some patients avoid the outdoors altogether or wear sunglasses inside. Our research is really two-pronged in its approach. The first research project involves the development of a sustained release form of topical cysteamine, and the goal of that project is to reduce the hourly application of this drop to once a day or possibly once a week. The second project is more long-term with a greater potential leap toward a cure for corneal cystinosis, and that project involves corneal stem cell transplantation. So we are using the mouse model developed by Dr. Stephanie Cherqui, and our aim is to transplant stem cells into the mouse cornea with the goal of blocking corneal cystinosis by replacing the diseased host corneal cells with healthy stem cells. Our preliminary results are promising, and we think that we are one step closer to a cure. My late father was a small-town pediatrician. The families in our community really relied on my father for many things, not only for medical knowledge, but for some support. And as a young child, I really saw firsthand how his work impacted children and families in our town. And it was through his work that I realized that the health and the well-being of children is totally directly linked to the health of a community. And I see that similar support in the cystinosis community. Patients who come and have a new diagnosis of cystinosis are really enveloped by this support by this community, and that's crucial. Being part of a cure for cystinosis is really personal for me because it really resonates with my desire to provide an unmet medical need for childhood visual impairment. But also, as a parent, I see that a cure would be incredible for these families. So much of why I am still a physician has to do with reaching out to patients who have no solutions. Our findings are very encouraging, and now more than ever, we do need the help to move this forward for a cure.